Governor Vessel 14, which is called the Great Hammer. So the location of the Great Hammer is at the lowest vertebrae and the topmost thoracic vertebrae. This is also known as the Hall of Seal, and that is the extra point that some people may have heard of, which is between the eyebrows. You can see clearly here, this is what you're aiming for, where that number 14 is. And the easiest way of finding this is looking down the thumb, looking in the lower arm part here, and then it's 1.5 finger widths down from the inside fold of the wrist. Thank you for joining me again today to see how acupressure can help with relieving the symptoms of some common ailments such as colds and flu. Colds and flu occur most frequently during the wet and cold winter months, and the first signs can often be a sort of sore or scratchy throat or an itchy nose, followed by then a runny or stuffy nose, a cough possibly, or even a headache, and potentially some joint pain as well. If there is a fever present, we tend to say that's flu. True flu or influenza is a viral infection, and that one can be quite serious, and for that one you need to refer to a doctor. But in the case of a normal cold or flu without complications, acupressure can really help by boosting the immune system to positively help your body in the recovery stage, and using the meridian points and the meridian lines. What this method of Chinese medicine aims to do is unblock the flow of qi through 14 meridians, which are situated throughout the body. And today, what I'd like to do is just focus on a few of the acupoints on some of those meridians that are really helpful when treating colds and flu. Those 6 acupoints are called Yintang, which is one of the extra points that are outside of the main meridian lines. But within the meridian lines, you have the large intestine 20. You have the governor vessel 14, the lung 7, the lung 9, and the large intestine 4. So the first acupoint that I'd like to look at and treat is Yintang. This is also known as the Hall of Seal, and that is the extra point that some people may have heard of, which is between the eyebrows. And you use the tip of the index finger, and obviously if you're doing it from the other side, you can do it on yourself as well with self-acupressure. And the pressure should be very light at first, because this is quite a sensitive area, and if it feels too much like you're putting pressure on, then just ease off and then go in and put pressure on, but don't overdo it. As I said, this is a very sensitive area. So quite light at first, and then you can circle clockwise first, and then anti-clockwise. And you can do this for 1 to 2 minutes and do what is comfortable for you. The second point is the large intestine 20, and that is known as welcome fragrance, and is on both sides of the nose. And you do this one either both together, or you can do first one side and then the other side. And again, very similar move. You would use pressure, and then you can circle clockwise and then anti-clockwise, and then do the same on the other side, clockwise, anti-clockwise. And sometimes until you get that clockwise and anti-clockwise movement, it is easier, I find, to do them one after the other. Otherwise your fingers tend to go in the wrong direction. And obviously be sensitive to the feelings around here. If your client feels it's too much, get the communication going so that they can tell you, even just lifting up a hand saying it's too much, and just pull the pressure off a bit. Because obviously if they've got a cold as well, they might be feeling quite sensitive in that area. But this should really help to relieve that. So the next point that will help with cold and flu is known as Governor Vessel 14, which is called the Great Hammer. So the location of the Great Hammer is at the lowest cervical vertebrae and the topmost thoracic vertebrae, and just where they meet is a slight hollow. Sometimes the easiest way of doing this is if you get your client to sit forward, it actually forms a little bump which creates a sort of little protrusion, and all you do is locate that protrusion and you press in with your pressure. You can either use your pointer finger or your thumb, depending on how much pressure you want to put in that area. And then you push using a steady pressure at first. But as I said, be a little bit cautious because it can be sensitive in this area. And then once you've used a little bit of pressure for about 1 minute to 2 minutes, then you pull off, and then because you've slightly agitated that area, what you want to do is palm rub the area all around that, just as a gentle massage around that area and the surrounding skin. And you can be gentle or vigorous depending on how your client is responding to that at the time. and that's the great hammer. So to get a clearer picture of where Governor Vessel 14 sits, also known as the Great Hammer, I have this wonderful diagram here which covers as many acupoints on the back area, but you can see clearly here this is what you're aiming for, where that number 14 is. So this is located at the lowest cervical vertebra and the topmost thoracic vertebra, and it's the dip between them here where that 14 is. Okay, the fourth point that we're looking at to help alleviate the symptoms of cold and flu is the lung 7, known as the broken sequence. And the easiest way of finding this is looking down the thumb, looking in the lower arm part here, and then it's 1.5 finger widths down from the inside fold of the wrist. So that is just here. Using the tip of the thumb, apply strong and steady pressure for about 2 to 3 minutes. And then once you have done that, you can circle clockwise and then circle anti-clockwise. And then obviously once you've finished this hand, you would go to the opposite side and do this on the other hand. Okay, the fifth point to help with the symptoms of cold and flu is known as lung 9, the great abyss, and it's located on the inside of the wrist crease, down from your thumb, and you again use the tip of your thumb into that dip and use a little bit of pressure there, again for 1 to 2 minutes, and then again circle clockwise first, then anti-clockwise, and then you would move to the other side, but take your time over these areas. So the last point for colds and flu is known as the large intestine 4. Word of caution on this one, it's not to be used if you are pregnant. It's also known as the Valley of Union. So the easiest way of locating this is if you put your thumb and your finger together in the area where they meet, just here, there's a slight bulge that you can see. And what you need to do is with the tip of your thumb, and sometimes it's better to have a finger underneath just to give you something to lean against. And you would apply pressure to that bulge for about 2 minutes. Some people do warm up this area either before or after. So you can do that by just rubbing at the area. Or there are certain warming tools that you can use, but you need to really know what you're doing when you use those. And you do this for about 2 minutes, and this really, really does help with your colds and flu symptoms. So that brings us to the end of locating these really useful acupoints that are going to help alleviate some of the difficulties you experience when you've got colds or flu, and hopefully that will help you or your client get some relief through using those acupoints on feeling a little bit better about yourself.